Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Assessment of the pain. So we need to know some important scales. So the best scale to measure the pain in children of 5 years of age. So up to like 5 years of age, we use the CHEOPS, the SCHEOPS. So this scale is the best scale. It's considered as the best scale. Then there is a visual analog scale is most widely used to measure the pain intensity. So in terms of the pain intensity, so if you're measuring the intensity, it will be the visual analog scale. It is the visual analog scale. So this is best for the intensity. So the CHEOPS for post-op pain. So in terms of the post-op pain in children, it does not include the oxygen saturation. So the CHEOPS scaling in the post-op, it does not include, there is no inclusion of the oxygen saturation. So to just recap, we saw the CHEOPS, it is the best for around 5 years of age, in children of 5 years age, and there is a visual analog which is used to measure the intensity of the pain. Then in terms of the post-op pain, there is a CHEOPS and it does not include the oxygen saturation. To learn and grow daily like this, please do subscribe.